How to treat low blood sugar level at home. What you need to know. If you're prone to low blood sugar, understanding how to respond quickly and effectively is essential for your health and safety. Managing these episodes at home starts with recognizing the symptoms and knowing the right actions to take. Low blood sugar, also known as hypoglycemia, can cause symptoms such as shakiness, confusion, dizziness, or fatigue. In more severe cases, it can lead to fainting or seizures if not addressed promptly. One of the fastest ways to raise your blood sugar is by consuming fast-acting carbohydrates. Options include glucose tablets, a small glass of fruit juice, or regular, non-diet, soda. These choices are rapidly absorbed by the body and can help restore blood sugar levels quickly. Your body relies on blood glucose as its main source of energy for everyday activities, from working and exercising to simply thinking clearly. Glucose is derived from the food you eat and is moved into your cells with the help of a hormone called insulin. When levels fall too low, it's critical to act fast. If you're using insulin or medications that affect blood sugar, always monitor your levels closely and keep a source of quick sugar on hand. You may also need to adjust your medication or meal plan based on guidance from your healthcare provider. Learning how to treat low blood sugar levels at home empowers you to stay safe and in control, no matter the situation. What foods can help raise blood sugar fast? If you're managing low blood sugar at home, one of the most effective strategies is knowing exactly what to eat and when. Since your blood sugar comes directly from the foods and drinks you consume, acting quickly with the right nutritional choices can make a critical difference. To raise your blood sugar fast, choose foods high in simple carbohydrates. These are quickly absorbed into your bloodstream and can rapidly restore glucose levels. Some effective options include a piece of fruit, such as a banana, apple, or orange, 2 tablespoons of raisins, 15 grapes, half a cup of fruit juice, apple, orange, pineapple, or grapefruit, half a cup of regular soda, not diet, 1 cup of fat-free milk, 1 tablespoon of honey or fruit jelly, 15 small candies such as Skittles, 4 Starburst candies, 1 tablespoon of sugar dissolved in water. Foods that contain protein or fat, like peanut butter, chocolate, or ice cream, may still be useful when blood sugar is mildly low, but they aren't recommended for immediate treatment. These foods digest more slowly and won't raise blood sugar as quickly as simple carbohydrates. Whole grains and high-fiber foods also take longer to absorb, which can delay the recovery process during a hypoglycemic episode. Follow the 15-to-15 rule. The American Diabetes Association recommends the 15-to-15 rule for managing low blood sugar at home. If your blood sugar is below 70 milligrams per deciliter, consume 15 grams of fast-acting carbohydrates. Wait 15 minutes, then recheck your blood sugar level. If it's still below 70 milligrams per deciliter, repeat the process. Once your levels stabilize, follow up with a balanced snack or meal to maintain control. Understanding how to respond with the right foods can help you manage low blood sugar safely and effectively at home. Always keep a fast-acting carbohydrate source readily available and follow your healthcare provider's guidance. Can you raise blood sugar without food? Yes. There are effective ways to raise blood sugar levels without eating food or drinking beverages, particularly in cases where oral intake isn't possible or practical. The most common method involves fast-acting medical products specifically designed to treat low blood sugar, such as glucose tablets and glucagon. Glucose tablets. Glucose tablets are an over-the-counter option available at most pharmacies. These chewable tablets contain a precise amount of glucose and are quickly absorbed by the body, making them a reliable choice for managing hypoglycemia at home. Glucagon. For more severe episodes of low blood sugar, especially when a person is unconscious or unable to consume food, glucagon may be required. Glucagon is a hormone that signals the liver to release stored glucose into the bloodstream, helping to raise blood sugar rapidly. Prescription glucagon comes in several forms. Injection kits with a needle and syringe. Pre-filled injectable pens for ease of use. Inhalable glucagon, delivered via nasal spray. These options are particularly important for individuals at risk of severe hypoglycemia and should be discussed with a healthcare provider. Having glucagon on hand and knowing how to use it can be life-saving in emergencies. While food remains the most common solution for mild to moderate low blood sugar, medical interventions like glucose tablets and glucagon provide essential alternatives, especially when rapid action is needed without food intake. How do I know if my blood sugar is low? Understanding how to recognize low blood sugar, also called hypoglycemia, is essential for effective management, especially if you're treating it at home. Blood sugar levels naturally fluctuate throughout the day. They are typically lowest in the morning, especially if you haven't eaten for 8 to 10 hours overnight. After eating, your blood sugar rises in response to food intake. What is considered a normal blood sugar range? Fasting, before eating 70 to 99 milligrams per deciliter. 2 hours after a meal, less than 180 milligrams per deciliter. Low blood sugar is defined as a blood glucose level below 70 milligrams per deciliter. However, the point at which symptoms appear varies from person to person. Common signs of low blood sugar. Some individuals may begin to feel symptoms when their levels approach 70 milligrams per deciliter, while others may not notice signs until their blood sugar drops significantly lower. Common symptoms can include shakiness, irritability, dizziness, lightheadedness, fatigue, sweating, confusion or difficulty concentrating. If left untreated, more severe symptoms may occur, such as loss of consciousness or seizures. How to confirm low blood sugar. A quick and simple blood glucose test can tell you whether your levels are within a normal range. If you have diabetes or a condition that causes hypoglycemia, it's important to monitor your blood sugar regularly using a home glucose meter. If your blood sugar reads below 70 milligrams per deciliter, immediate action is necessary to raise it, whether through fast-acting carbohydrates or prescribed treatments, depending on the situation. What are the symptoms of low blood sugar? Recognizing the symptoms of low blood sugar, also known as hypoglycemia, is key to treating it quickly and safely, especially at home. These symptoms can vary significantly from person to person and even from one episode to the next. Common symptoms of low blood sugar. Mild to moderate hypoglycemia may present with symptoms such as shakiness or tremors, dizziness or lightheadedness, sweating, confusion or difficulty thinking clearly, sudden drowsiness or fatigue, trouble concentrating, unexplained irritability or mood changes, intense hunger, rapid or irregular heartbeat. These symptoms are the body's early warning signs and typically occur when blood glucose levels fall below 70 milligrams per deciliter. Prompt treatment at this stage is crucial to avoid progression. Severe symptoms of hypoglycemia. If blood sugar continues to drop and is not treated, more serious symptoms may occur, including inability to eat or drink, seizures, loss of consciousness. These severe symptoms require immediate medical attention. They may occur if hypoglycemia is not recognized and treated quickly. Hypoglycemia unawareness. Some individuals experience hypoglycemia unawareness, a condition in which typical warning symptoms no longer appear. This can develop over time, especially in people with long-standing diabetes, or result from nerve damage that affects how the body senses low blood sugar. This condition can be particularly dangerous, as it delays recognition and treatment, increasing the risk of severe hypoglycemic events. If you suspect hypoglycemia unawareness, it's essential to consult your healthcare provider for a personalized management plan. Monitoring your blood sugar regularly and being alert to even subtle changes in how you feel can help you detect low blood sugar early and take appropriate steps to correct it, right from home. What can cause low blood sugar? Understanding the causes of low blood sugar, or hypoglycemia, is an essential part of managing and preventing it, especially when treating episodes at home. Low blood sugar can result from a variety of factors and may affect both individuals with and without diabetes. Common causes in people with diabetes. For individuals with diabetes, hypoglycemia may occur due to too much insulin. Administering more insulin than the body needs can lower blood sugar excessively. Variable insulin absorption. Differences in how insulin is absorbed, due to site of injection, temperature, or circulation, can impact its effectiveness. Delayed or missed meals. Skipping meals or going too long without eating can lower blood sugar, especially if diabetes medications are still active. Overuse of diabetes medication. Taking more than the prescribed dose of insulin or oral medications, such as sulfonylureas, can cause a significant drop in glucose levels. Intense or prolonged physical activity. Exercise increases glucose utilization by muscles, which can result in hypoglycemia if not balanced with food intake. Causes in people without diabetes. Low blood sugar can also affect individuals without diabetes, often linked to underlying health issues, such as kidney disease, advanced cancer, eating disorders, severe liver conditions such as hepatitis, low adrenal function, adrenal insufficiency. In some cases, reactive hypoglycemia can occur after meals, especially in those with a sensitivity to insulin or carbohydrate metabolism disorders. When to seek medical attention. Immediate medical care is necessary if symptoms become severe, such as seizures, loss of consciousness, or an inability to swallow. These situations are more common in individuals taking long-acting insulin or sulfonylurea medications. If you do not have diabetes but experience persistent or worsening symptoms of hypoglycemia, even after consuming 15 grams of carbohydrates, you should consult a healthcare provider. These symptoms may signal a more serious or undiagnosed health condition. Recognizing the underlying causes of low blood sugar is a key step toward effective prevention and treatment, whether at home or under medical supervision. Takeaway. Low blood sugar can often be a temporary issue caused by skipping a meal or not eating enough. In many cases, it can be managed safely at home by quickly consuming a snack to raise your blood sugar levels. However, it's important to understand that low blood sugar can escalate into a medical emergency. This condition may be linked to diabetes or other underlying health issues. If your symptoms become severe, or if eating a snack does not improve your condition, or worsens it, you should seek immediate medical attention. Working closely with your healthcare team is essential. They can help you understand your blood sugar levels and develop an effective management plan tailored to your needs, whether you have diabetes or not. For more expert health information and guidance on managing blood sugar and other health topics, subscribe to the HeInfo channel and stay informed.